Welcome, listeners, back for a brand new episode of The Spirit of Hagyard. We are thrilled to be here today with a very special guest, Dr. Matthew Sprier. Welcome to the Spirit of Hagyard podcast.
Hi, Jody. Thanks for having me.
Well, we are excited to have you, and as our listeners can probably already tell, that you may not be from around here, as sometimes we say in the state of Kentucky. So, Dr. Matthew Sprier, you're actually coming to us today from the esteemed University of California at Davis. You are a professor of diagnostic imaging there at the School of Veterinary Medicine, but tell us where you are originally from as well.
Yeah, so you might have noticed that my accent is not from California. I came from further east. So yeah, I grew up in northern France. I got to go to vet school in Lyon in France and graduated from there over 20 years ago. After that, I had a quick transition with a couple of years in Quebec, which is kind of the bridge between France and the US. I got to do an imaging residency at University of Pennsylvania. And then I've been in Davis for almost 18 years now, but really enjoying being here in California.
Well, we are excited to dive in today to your specialty, which is diagnostic imaging. But I do really love to kind of speak out your research focus. It was really a wow moment for me, but the advanced musculoskeletal imaging in horses, and in particular, the development of PET imaging, which we'll talk about today, for not only lameness assessment in sport horses, but also the prevention of catastrophic breakdown in racehorses. So I am really excited to dive into this category and learn more about what it is that you do and the advancements that have come from PET imaging.
I think that's been really interesting to be able to bring something new to the table. And you were talking about UC Davis, and I think, in large part, I was lucky to be in this place at the right time, because this is not something I'd been thinking about a while. Oh, we need to bring PET to the table. It was just being here and getting an email out of the blue from an engineer on campus who was like working on developing a new type of PET scanner and asking whether there would be some application in horses. So I think it's truly a good story, a good UC Davis story, and that's over 10 years ago. But so that's how it all started. Somebody threw that idea, and I was like, well, this is interesting, but it was not necessarily that straightforward from the beginning, because, PET, if you know a little bit in human medicine, it's used a lot for cancer imaging. And I think we all know that horses are really good at getting themselves in trouble, but there's one thing that tend to stay away is cancer. Compared with other species, horses don't have that much cancer. And so first it was well, we're not that worried about cancer in horses. And there was very little published about bone imaging. But when I found a really small reference about the use of PET it was a human paper called imaging for unclear foot pain. I was like, hold on, there's something we should explore, because unclear foot pain is something we're dealing with in horses. And so that's how that whole story started. Just okay, let's explore that and let's see what we can do. And we've accomplished a great deal of things from the initial scan we did to where we are today. A lot has happened.
We are, so many of us, familiar with the conventional modalities of radiographs and ultrasound and scintigraphy even. So when we talk about the advanced modality of PET specifically, what are the advantages that you would talk about? I want to ask you about both the advantages and the limitations, but let's start with the advantages.
Yeah, so I think we just build that up, because you're right. There's a lot of different imaging modalities that are around. And if we want to explain a bit more about PET, I think, we tend to say that an image is worth 1,000 words. I'm an imaging person, so I might want to share a couple images to try and explain that a little bit better. So I believe you can see on this image, this is the very first PET scan we did. And so at the time I mentioned this was really research. And so we were working with a prototype. And so this system had been built as a prototype for human brain imaging. So it's a small cylinder. And so that explains why we had to have this horse under general anesthesia. So that is how it started. We're actually almost 10 years ago. This was April 15, 2015. So we're going to have a party for the 10 years anniversary. But so that is what the system took initially. And then a few years later, we were able to develop that system that would open up to be able to safely image horses standing. And from that, we were able to image all kinds of horses, and we can get back to that. But to answer more specifically your question, and you made the comparison with scintigraphy, and I'll show an example of that, because this is what scintigraphy are. So this is a bone scan. And so we're getting 2-dimension images. And so we'll image the leg from each side, from the front, but we're getting projected images which have relatively low spatial resolution. And then what the PET is that image here on the right, which is pretty much a 3D bone scan. So what we're looking at here is the 3D version of these images we have there. And so that's going to be a classic example in a racehorse. And on that bone scan here, we're looking at the fetlock, so the ankle, and we can appreciate that there is, we're looking here at area where there's some bone activity, bone turnover, and we can appreciate the bone turnover here on the bone scan, but the PET scan shows it in 3 dimension and shows it with much more precision, which is very important here because we recognize these 2 spots here, which are the one we can see on the bone scan, but then we have 2 additional spots that we couldn't catch on scintigraphy, and these are in the sesamoid bones, and the sesamoid bones are one site of concern for fracture in racehorses. So this was really when we realized that we could catch in the sesamoid bone some findings that we couldn't catch on bone scan, that we were having trouble seeing with CT or MRI, that we wouldn't see on radiograph. This is what really brought PET to the table as a potential tool to really help seeing in racehorses things we couldn't see elsewhere.
That example between scintigraphy and the PET scan is really impressive.
PET was born here in UC Davis, but as we're talking about Kentucky, I think Kentucky and Lexington has had a really important role in the development of the PET scan, because this was with this type of pilot data that I got invited for the first time back in 2018 to the Thoroughbred Safety Committee, and at the time Craig Fravel was president of Breeders' Cup. And that's through that meeting that we showed this kind of pilot data. And then with support from the Grayson Jockey Club, which is also a really important institution based in Lexington, that supported the initial research. So really the support we got from these Kentucky people is what led to the development of that first standing equine PET. So I would say equine PET came from some brainstorming in Davis, but a lot of support from Kentucky. And so I think I definitely want to acknowledge that at this stage.
Yeah, so important. I always love to speak to those partnerships. And as big as our industry is, it's also such a small industry. And so those partnerships are so key to the advancement of medicalization of our equine partners, whether they're athletes or otherwise. So I think that's so impressive. Now, you also have partnerships or serve as a consultant with some racetracks, isn't that correct? So that made me think about your partnership with Churchill Downs and even Santa Anita. But I think that you truly are serving our industry in advancing diagnostic imaging.
Yeah, that's been really great to work with the racetrack. And I think Santa Anita was the first one to install the standing PET. And that is just over 5 years. It was December 2019. And this has been amazing working with the team down there, Southern California Equine Foundation. And they've scanned a lot. I think right now they are reaching like 1,200 scans. So they're scanning over 250 horses a year at this stage. And so we've learned so much. I mean, it's a good and fun story. I remember the first time I went down there, we installed the scanner, And they asked me, "Are you okay if there are some journalists there?" And I was like, "Sure, yeah, I'll be happy to present to a journalist." Come out of that room, there's like 20 cameras. So it's just like, that's when you know you're in LA. And, but so it was really interesting to see like the global interest. But then the question I had at the time was like, so can you tell from that scan whether a horse is at risk of breaking down? And at the time, I'd look at 12 research horses. So I was like, well, we know there's great promise, but we're not there yet. Once I've looked at 200 horses, I'll have more knowledge under my belt. Well, now I've looked at over 1,000 at Santa Anita, plus the one at Hagyard, a bunch in Florida too, and also a scanner in Australia. So now I've looked at several thousand of them. And indeed, we've accomplished that. And so that's why now we've reached a stage where we can use it and have a good idea, is this horse safe to race, yes or not? And so we've made a lot of progress with that through all the studies that we've done with the racetrack. So Santa Anita, Churchill Downs have been the main one, a few places scanning in Florida, and the first international PET scan that's at Melbourne University, and we're working with Racing Victoria on that.
Yeah, incredible. Now, help us understand, Dr. Sprier, this specifically is the long mile PET scan. So can you just help us understand the difference between knowing what you're talking about, what the long mile PET scan is, and what makes that different than others?
Yeah, so the long mile is a pretty unique PET scan because that's the only PET scan that has been built specifically for horses. So this was this image I was showing earlier. So from Brain Biosciences, which is the company that existed like before Long Mile, but so that's called Brain Biosciences, so brain, not foot. And so because it was, again, like that prototype designed for imaging the human brain, but so working with the team at Brain Bio, they acknowledged the need to develop something specific for imaging horses, and so that is that mile PET from Long Mile with that design. And so that's the concept of the PET. Because we're capturing three-dimensional information, we need to capture from all around instead of just having like a planar detector like a gamma camera. But it was really important to have something safe to put around the horse, and so that is actually the early evaluation and demonstration of the safety of the system. Is that what happens if the horse moves, and if the horse moves, the scanner like opens freely. So this is safety for the horse. And if you want to see the scanning process, I can show it to you there. So the advantage is that back in COVID time there, but we have the horse sedated and the scanner is on wheel, and so we open the ring and we can drive the scanner to the horse. And my colleague here will just like close the ring around the fetlock there. And so that scanner moves up and down. And so we can scan from the bottom of the foot all the way up to the knee. And it's going to take 3 to 5 minutes to scan the foot, 2 to 4 minutes to scan the fetlock. So really like an easy process to scan, easy and safe. And a scanner that's relatively portable, which brings like another interesting story, is the ability of sharing the scanner between different places. And we've started that here when we had the racetrack Golden Gate Field that unfortunately has closed now. But we would load the scanner in a horse trailer, actually, drive to the racetrack, and we would be able to scan at the racetrack and then come back here. And that's the same story with Hagyard. Having the scanners that they can operate either at the hospital in Lexington or take to Churchill Downs. So really convenient to be able to bring the scanner to where the horses are. And a little bit more of technique behind that. I think we should cover that. So the way this works is that we need to inject the horse with a small amount of what we call a radio tracer. So it's a small amount of radioactivity that's going to go onto the bone. But this is very short-lived radioactivity. And after 5 hours after injection, you cannot tell that the horse is radioactive anymore. And that's why the horse can go back to their barn. But so that's a bit of the logistic. As you see there, we have to put an intravenous catheter. We inject that tracer. We wait for 30 to 60 minutes for the tracer to find the spot in the bone that are abnormal. And then we image with that scanner.
Really fascinating. And I'll take that opportunity just to remind some of our listeners who are listening and not watching, they're going to want to watch this because you have some really impressive images and videos that bring these advantages as well as the how-to and what it does to life. You started to mention just briefly, some of the limitations, right? It is pretty mobile, but it takes up a little bit of space. So what are some of the limitations that you might speak to of this technology?
Yeah, so this technology is telling us, like you've seen on the images, we're looking at hot spots. And so we're going to see something that's brighter on the image. And this is telling us there's something happening right at that spot. But so this is what we called a functional imaging technique. It's going to tell us there's something abnormal in the bone. But this is different from more classic imaging technique like X-ray or like a CT scan that are going to show the size and the shape of the bone. And so it's very important to understand the difference. And the advantage of getting that functional information is that we'll be catching things earlier. Or if we have an old injury, we can tell, is this injury active or not? But it doesn't bring like all the information about the size, shape, and the structure. This is why in some cases, we're going to decide to actually combine it with a different imaging modality. And so for who are watching, I can show an example of that because this is really interesting to see when we combine the PET with some other imaging techniques. So we can overlay it on some CT images, and I'll show an example here, which is actually something different from all the racehorse we've talked about. And we mentioned, like, initially we were working on the racehorse with all the interest in injury prevention. And so this is what really brought that to life. But we also realized there's a lot of other application. And so this is an example here where if we just look at the PET scan images, we get that 3D volume with on these images, we can see these more like yellow spots that are sites where there is some bone remodeling. And then to get more information, because we don't know necessarily exactly where that is and what the bone looks like under that. And so this is where we combine it with a CT scan. So on this screen here, these gray images are the CT that shows the size and shape of the bone. And the yellow stuff is the PET, indicating where there is some activity. And so here we're kind of addressing the limitation of PET of not seeing the size and shape of the bone with adding the CT. And we're helping on the CT side because what you can see on the CT here, so we're looking on both sides of this bone here. There's this little like concave area, which is attachment of a ligament. And they're both like slightly abnormal shape, but abnormal shape could be an old injury. And here it's really helpful to have the PET information that is telling us this ligament attachment as an issue. This is actively remodeling. And so this was the reason this was an eventing horse that has a collateral ligament injury that we could recognize thanks to the PET.
That's just so fascinating. And I think that it speaks to some of what you have really started to educate our industry about, and that is the role of diagnostics and where we are on what I might call the continuum. So if you'll speak to, diagnostics and then monitoring on the racetrack side of things, we might say clearance to race. You just spoke about sport horses where we may be monitoring for clearance to compete at that level. And then I know that you've spoken in the past also about the potential of future screening. So can you talk a little bit about the continuum that you have referenced about the role of diagnostics and where we are, where this kind of technology of PET takes us?
Yeah, that's an excellent question. And that's what is super exciting because, in medicine, the first step is going to be diagnostics. And we know there's an issue clinically, we need to find an answer, we need to find what's going on. And that's the first step of medicine. And that's what we classically do with most of the imaging technique. But now that we have some refined, more advanced imaging technique, we can definitely take that further. And so the first step is going to be having techniques that allow for monitoring. So we find that injury and we're going to manage this horse one way or another depending on the type of injury. But it's going to be really important to know when is the right time to get back to the track or to get back to jumping. And so that's kind of the first step of following. And so this is where having some functional information from the pet is super helpful to get there. And so that's definitely, we started with just doing some diagnostics, then we started to do some following, and then comes the screening question. And so the screening is always a little scary, and sometimes you feel like you're opening a can of worms because people are worried that their horse is perfectly fine and you're going to tell them not to go. And I appreciate this concern and I understand where this is coming from. And so this is why I'm explaining when we started, we didn't do that. We were not ready to do screening when we first started. But with more experience, having followed up some horses back in training, and then something that was very important that we did a couple of years back, we did a pretty large study with Santa Anita, Golden Gate Field, and in collaboration with New Bolton Center, University of Pennsylvania. They also had some race horses over there, and we looked at normal horses. So defining normal is never easy, but what we called normal in that study were race horses that had raced in the last 2 weeks, had finished in the top 3 of a race, had been looked at by a vet after the race, and the vet had confirmed that the horse were going sound. And so this is what we defined as normal horses. And we looked at these guys in order to know what to expect in normal. And that's what we've learned. And I can probably share some of that because what does normal mean? We are going to see some area that do light up, but this is within normal limits to have some specific area lighting up. And we've learned that through this study. And so we imaged all 4 fetlock on a total of 72 horses. And indeed, some horses had no abnormal uptake at all. But we studied all the different areas in the fetlock. And there are indeed some areas, especially in the palmar condyle, and so that's going to be the bottom of the cannon bone. And so we realized that this did happen quite a bit in normal horses. And actually, when we compare that with abnormal horses, which was the population we had scanned at Santa Anita early on, we can see that in these abnormal horses, and you can see some grade system, we are able to quantify and see how much bone turnover there is. And we were able to show that these normal horses were different from these abnormal horses. And but the sesamoid bone, see, we got very little in the sesamoid bone and the normal horses and much more in the clinical horses. So from that, we have learned what are we comfortable with in a horse to say it can safely run versus what are we more worried about a risk for breakdown. And all this merges pretty well with some research that's been done through the years, in large part to actually both in California and in Kentucky, looking at the injury happening at the racetrack. And so this is a good example of a paper from the orthopedic research lab where they were showing that there's this specific spot in the sesamoid bone that is related to fracture of the sesamoid bone, which is catastrophic for a racehorse. And so we knew that from the pathology side, and the challenge is how can we find that in live horses, because it's one thing to be able to look at the bone under a microscope, but you cannot do that on a live horse, obviously. And so that was very exciting because this is what we can see on this PET. You can see that hot spot here is matching exactly what they are looking at on the post-mortem floor. And so this is going to be a good example. This is a case because of that specific uptake in that area, because of the pathology knowledge we have, because we know that we don't see that in most normal horses. This is a horse that is at risk, and this is a horse that needs to be managed accordingly. But if we just have uptake, let's pretend there was no uptake in this sesamoid bone and we just see a bit of uptake in this palmar condyle, I would be perfectly fine with letting that horse train and race, because we know that this is within normal limits to have some degree of uptake there. So there's really a lot of information we've gained from looking at these horses with injuries, looking at abnormal horses, so that now we are at a point where we understand that having this finding in this horse is compatible with training and racing versus that other area. And so this, I don't want to get too technical here because it's going to depend on the exact location, on the activity, on the association of other findings. So this is not something I can summarize here in 2 minutes. But we definitely have gained a lot of knowledge in the last 5 years. And so now we're pretty comfortable that we can distinguish a horse that's at risk versus a horse that is safe to race.
Really, I think, unbelievable and just speaks so well to our future. You know, there has been so much concern as we continue to, as I like to say, run faster and jump higher, and ask our, equine athletes to continue to advance. And so where do you see this in the future? Obviously, we're talking about some what we might call high concentration equine areas, from the UC Davis and California geography to the Kentucky geography and moving towards Pennsylvania there with New Bolton. And you mentioned Florida a couple times. Where does it go from here?
Well, it keeps growing, and that's what's fun and exciting, because indeed you mentioned Kentucky, California, and Florida, and so there's 3 PET scans in each of these states, plus the one in Pennsylvania. So this was a 10 PET scans that were around last year. But yeah, there was a PET scan installed in Texas back in December. There's one going in New Hampshire early summer, the one in Australia I've mentioned before. And so, yeah, I think this is becoming available to more and more people. And so I think we talked about the racetrack a lot, and the fact, scanning at Santa Anita, scanning at Churchill Downs, scanning in Florida is really important and has been really helpful. What I like the most about that, because, we were talking about the diagnostic versus the monitoring and screening. And I think the monitoring is very rewarding. We have a couple horses. There's one horse from Santa Anita that's been scanned 11 times over 4 years. So this is a horse that was diagnosed with a pretty significant injury as a 2-year-old, and he got significant amount of time off as a 2-year-old, got him back to racing pretty well as a 3-year-old, then kept monitoring. It took some more time off during the 4-year-old, but then was racing again as a 5-year-old. And that's a horse that raced internationally, has over $1 million in gain. More recently, we have another one that we've scanned 4 times in the last year, and that has also raced very successfully in the recent times. And to me, that's almost the most exciting, because it's always like, it's good to find an answer, but when you find an answer and the answer is just like, okay, it's going to need some time off, it's just more frustrating. But when you're like talking with a trainer and figuring out when the horse needs time off, when he can go back, and then seeing these successes back on the racetracks. This is the most exciting part. And so this is quite a few trainers at Santa Anita and Churchill-Downe have understood that, and it's really exciting to work with these guys. We have a bunch of example, end of season, trying to decide, November, December, how much time off are we going to give to that horse before we bring it back for another campaign. Another really useful application has been, slightly older horses, talented mares. Shall we go for another season, or is it time to stop and to go to breeding? That's been super helpful with that. And so this is growing in the racehorse world. I think there's a lot of application for that in the sport horse world. And so Florida is kind of the perfect connection between the two, with the scanner in Ocala and Wellington, where they see a lot of sport horses. And so we have a big project going on with funding from Grayson Jockey Club, looking at subchondral injury of the fetlock in sport horses. And that's something that we recognize more and more. And it is different from the race horses in the way that it's not as dramatic as unfortunately it can be in the race horses. But this is also an issue that happen in the fetlock that build up over time because of stress remodeling in the bone. And the problem, if you identify it too late, there's not that much you can do once you have severe damage in the bone. But with PET scan, we have the ability to recognize it earlier and modulate the training. This is also going to be a great opportunity to just compare different treatments as we can follow up. And so I think in the sport horse, with all this subchondral injury in the fetlock, and then another important injury are all the ligament injury, and I show that example in the foot. Suspensory ligament is another big one that is difficult to monitor, and once you have some issues there, changes are going to remain there. And I can show an example on that too. So the value of PET to look at some sport horse suspensory injuries. And this is an example. Actually, this is a quarter horse, but that has a CT. So that's a suspensory origin. So we're on the front limb at the top of the cannon bone, and we can see that activity on the PET showing that there's some active lesion there. And what's really interesting is that these are difficult to monitor, because when you look at the CT 4 months later, the CT still looks very abnormal, because once you've had that damage, the changes are going to remain there. But the PET is showing that things are much more quiet. And speaking of the suspensory, I'll illustrate one more thing here. Sorry to throw so many images, but I'm an imaging person, so I just like to talk at images.
It does seem to be your specialty.
Yeah.
Very impressive images.
That's my job. I just look at images. It's an easy job. And so another aspect that we haven't touched on, we've talked a lot about bone. And so bone is 80% of what we do with PET scan. But what's really interesting too, that there is a tracer that is good to look at soft tissue injuries. And so that's an example here. We're down in a horse foot. And so that's another PET image. But you can see that this PET image looks very different from the other PET images I've shown you, because the other PET images I showed, all the activity was in the bone, when here we have some yellow stuff outside of the bone. And this yellow area indicates a lesion. When we use the CT for anatomical reference, we have a lesion in the deep digital flexor tendon, which is a big tendon in the horse foot. So we can see tendon injury there. And then what we can do is, if we work both with the bone and the soft tissue, that's an example in this case. So we're back in the suspensory ligament. And so this suspensory ligament injury, we're talking about ligament, we're talking about soft tissue, but a lot of this injury happen at the attachment of the ligament on the bone. And so that's why we're going to be interested in using dual tracer. And so here, using the bone tracer, we can see that lesion on the bone at the attachment. And then when we go further down, we can see on this image, which is using the soft tissue tracer, we can see that yellow stuff in the soft tissue. And so in that case, we're able to recognize active lesion, both involving the connection between the ligament and the bone and in the soft tissue itself, with, again, also the ability of like following up on this tendon and ligament healing, because that's another one that is like pretty tricky. All of these suspensory injuries, we're going to use ultrasound a lot on these, but once you have scar tissue, it can be difficult to decide, are we just dealing with the scar or is the injury still active, which obviously is a very important question to answer in order to decide to get that horse back into work or not. And so PET is very helpful for monitoring there, both for bone and for soft tissue.
Dr. Sprier, you have taken us to school today on not only diagnostic imaging, but certainly the PET modality of imaging. And I know that we could continue to show more and more amazing images, but I do want to just kind of pause here and thank you for your partnership with Hagyard. We are so excited for this opportunity to showcase our service and the fact that we have access to PET and that we continue to be able to not only diagnose, use diagnostics, but also, to your point, to monitor and even to screen. And that this is so applicable to not only our racehorses and thoroughbreds, which in Central Kentucky we certainly focus a lot on, but not to mention the sport horses that continue to grow, not only here in Central Kentucky, but, across the country, and how much opportunity we have to support those athletes. And as you showed off, I don't want to leave our Western sport horses out of this either, right? Because you certainly shared some of those examples, and that's a huge area of interest in the United States as well. So, Dr. Sprier, any final thoughts for our listeners, as this may be maybe the first time some of them have heard about the opportunity of PET scan, and for others, they may simply be going through vet school and are like, okay, I want to do this. What would you say to our up and coming leaders in the industry, young veterinarians, of what they have to look forward to?
No, I think it's a very exciting time to be in diagnostic imaging. And, I reflect, you mentioned I graduated from vet school a couple of years ago now, over 20 years. But, I finished vet school and we were still using screen film, and we had ultrasound with tiny screens. And so it has been so exciting to be at this stage and, having ultrasound develop bigger and bigger, have CT and MRI, and then be able to add PET. So I think this is just so exciting to have all these modalities and understand how to use them, because it is true that now we have the question is so which modality do we have to go to? It's a lot of choice and a lot of options, but I really value having all these options around. And I think preventive imaging is what I'm the most excited about. Being able to image early and being able to monitor, this is the way to go. And so I think that's the message we try to get across, because I think people might be worried that you're going to image, you're going to find something, so we're going to sideline this horse. And that's really not what we want to do. And I think what we want to do is image to keep the horse racing, to keep the horse competing. And we are in much better shape than we were 5 or 10 years ago to be able to do that, thanks to all the imaging we have. So don't be scared of imaging, embrace imaging. And I think coming together and discussing these things, I just want to thank Hagyard for the opportunity to work with them, because PET has been, again, something that just fell on my lap and I work hard on it. But then what has been super exciting is to just create these images, learn these things, realize what we can do. But what I've enjoyed the most in the last few years is the opportunity to connect with all these people. I've come to Kentucky at least once a year for the last 5 or 6 years. This has been great. I get to discover what's happening in Florida, which is a bit of a different world, but that's been very exciting. Working with the Australian is just like coming together, discussing these things, and learning from each other, because we all have slightly different population of horses, and this has been really great to work on this as a team, because it is really teamwork. It is what we see on the imaging, what the clinician sees, what is important to the owner, to the trainer. But this is fantastic to put like all the pieces of the puzzle together to keep our horses healthy and race and work strong for as long as possible.
Dr. Matthew Sprier, Professor of Diagnostic Imaging at the School of Veterinary Medicine at UC Davis. We thank you so much for being here with us today, for your partnership with Hagyard, and we appreciate all your time and knowledge. So listeners, don't miss this one. If you are just listening and not watching, you're going to want to come back and watch this one again for sure. So thank you, Dr. Sprier, and have an amazing day.
Thank you very much. I really appreciate the opportunity of talking with you all. Thank you.
Thank you.